There's been a lot of discussion about breast cancer in the media, particularly with Angelina Jolie's story. So people have been talking a lot about the BRCA gene mutations. And when it comes to breast cancer, we basically see two groups of patients. We see the sporadic group, which makes up about 80% of breast cancer patients, and then the genetic group, which makes up about 5 to 10%. And then we see the familial group. So in the genetic group, basically, we're seeing a lot of these patients with BRCA, or what we call BRCA mutations. These mutations are genetic mutations that are inherited from a mother or a father, and they cause a significant risk of breast and ovarian cancer. We're seeing more and more patients who we're identifying as being high risk that we're able to put through our risk assessment program, and we're able to evaluate them through our genetics counselor, and then we can offer BRCA testing, which is basically a blood test, or it can be a buccal swab from your mouth, so that if we can identify these patients as having inherited BRCA mutations, at that point we can discuss with them their management. So the three different options that we would discuss with a patient with a BRCA mutation would involve increased surveillance, which is including mammograms, ultrasound, and MRI every 6 months, or what we call chemoprevention, which would be involving tamoxifen, or surgical management. The surgical management of a BRCA patient will be basically discussing with them whether they want to proceed with prophylactic mastectomies. Angelina Jolie had a prophylactic bilateral nipple areola sparing mastectomy. She had it done in 2 stages that took about 3 months. We've been able to develop that technique so we can do the same procedure in 1 operation that often takes 6 weeks to recover from, and we've been able to offer that operation with excellent results.